Thank you for joining us to review some information about early pregnancy. Types of pregnancy. There are different types of pregnancy. Usually when someone finds out that they are pregnant, it's by doing a home pregnancy test or by checking the pregnancy hormone level in their blood. The pregnancy hormone level in the blood is called beta-HCG. When someone has a chemical pregnancy, this means that the pregnancy hormone is detected only chemically, and we're not able to detect a chemical pregnancy on ultrasound. Sometimes if someone isn't trying for pregnancy, they may not even realize that they had a chemical pregnancy. They just might think their period came late. Ectopic pregnancy is when implantation happens somewhere outside of the uterus, for example, in the fallopian tube. This type of pregnancy cannot carry on to be a live birth. Clinical pregnancy is when a pregnancy is detected by ultrasound. And multiple pregnancy is when someone is pregnant with multiple babies at one time. Monitoring pregnancy. The first test that will be ordered to check if you're pregnant is going to be the pregnancy blood test, beta-HCG. It is typically done 2 or more times as required to see how the pregnancy hormone level is behaving and if it is rising appropriately. Next, the doctor will order an obstetrical ultrasound. This is typically done between 6 to 8 weeks gestation, but it may be ordered earlier. The doctor will discuss with you first trimester screening. After the first trimester, you would graduate and an obstetrician, midwife, or family doctor would monitor your care and offer some options for second trimester screening. Every pregnancy is different and symptoms come and go. Sometimes people get worried if they're not experiencing particular symptoms, or sometimes they get worried if a new symptom comes up or if a symptom they were experiencing is no longer there. This is all very common. Some symptoms include, but are not limited to, fatigue, fainting, breast changes, constipation, gas and bloating, frequent urination, backaches, headaches, mood swings, cramping, leg cramps, nausea and vomiting that can sometimes be at certain parts of the day or sometimes they can last all day. If you're concerned about any of the symptoms you are experiencing, please speak to one of our nurses. Nausea and vomiting, what can help? Avoid smells that bother you. Sniffing lemons or consuming ginger can sometimes help. Try to get enough rest, as nausea is worse when you are tired. Eat whatever pregnancy-safe food appeals to you when you're hungry. Some people find eating a few dry crackers first helps. You may find it helps to get up slowly and not to lie down too soon after eating. Eat small meals or snacks often so your stomach doesn't get empty or full. Don't skip meals, but keep them small. Eating some salty crackers can help settle the stomach enough to eat a meal. Sip small amounts of fluid often to avoid getting dehydrated. Acupressure bands help some people, and you may find it works for you. Try temporarily substituting iron-containing vitamins for folic acid or for vitamins that are low in iron. Practice mindfulness techniques. Try pharmaceutical-grade ginger. Food and drink, some things to consider. Follow Canada's food guide. Follow your doctor's recommendations about weight gain and pregnancy. Tips to avoid food poisoning. Some bacteria, such as Listeria, can go through the placenta barrier. Please review the cook, clean, chill, and separate information in this slide. Food and drink to avoid. This is only a partial list. If you are unsure if something is safe to eat, please consult with a healthcare professional. Please avoid raw meat, fish, oysters, clams, and mussels, deli meats unless dried and salted, pâté, smoked seafood, raw eggs or products that contain raw eggs, some salad dressings, cookie dough, mayonnaise, unpasteurized milk, cheese, or juices, raw sprouts, and alcohol. There is no safe known amount. Medications, vitamins, and supplements. Do take folic acid as advised by your doctor. This can help prevent some types of birth defects called neural tube defects. Prenatal vitamins contain folic acid. Any other medications, vitamins, or supplements should be checked with your doctor or pharmacist before taking. Toxic substances. Do not smoke or vape during pregnancy. Avoid secondhand smoke. Do not use marijuana or cannabis during pregnancy. Do not use illegal drugs during pregnancy. And do not change or handle cat litter. If you must do this, please wear a mask and gloves. Physical activity. It is great to have physical activity during pregnancy, unless advised otherwise by your doctor. Physical activity can reduce some negative pregnancy symptoms and improve your mood. Strive for 30 minutes per day, most days of the week. Some examples of physical activity include walking, swimming, stationary cycling, low-impact aerobics, or pelvic floor muscle training. Please remember to stay hydrated and not to overheat. Travel. Avoid travel during the first trimester. Generally, travel is safe during the second trimester unless your doctor tells you otherwise. Check your airline policy about restrictions of travel in the third trimester. Consider travel insurance and trip cancellation insurance. Be aware of safety about the region that you are traveling to, including diseases, outbreaks, safe food and water. There is a risk of deep vein thrombosis when sitting for prolonged periods. Remember to walk and stretch every 30 to 60 minutes. Lifestyle. Intercourse is safe during pregnancy unless told otherwise by your doctor. Hair color is safe as long as it is free from ammonia. Working is safe during pregnancy unless you are otherwise told by your doctor. Bleeding. About 1/3 of pregnant people have some bleeding during the first part of their pregnancy, and about half of the pregnancies with bleeding continue without further problems. Miscarriage occurs in 15 to 20% of pregnancies. Overall, there is no treatment to stop a miscarriage. If you are bleeding in pregnancy and have a negative blood type, you might need an Rh antibody injection. This depends on how far along you are in your pregnancy when bleeding occurs. Extra resources. For more information, please review some of these websites. Thank you for taking the time to review this presentation, and we wish you all the best.